morning. Being the last day, of course, I want to have a disclaimer that there could be a few overlaps, but you will bear with me. And so I will speak to you about how best to spark the demand for adolescent health services. And maybe just for those that have not been in Uganda, that is Makerere University School of Public Health. That's where I work. And to the left is the main building. We usually call it the Ivory Tower. And now we are trying to expand. Those are artistic impressions, but we are already in construction. We're also affected by some funding, but we are still mobilizing. So I will make a short introduction. Then I will indicate some of the adolescent problems, global and also sub-Saharan Africa. And then I will talk a little bit about the discrete needs for adolescents and the need to spark their interest, their demand. And then I will talk about two institutions that we think are centers of excellence in this domain. So about 1.2 billion people, or 1 in 6 of the world's population, are actually adolescents, 10 to 19. And adolescence is, as we have already been hearing from the previous speakers, a period between 10 to 19, and it is a unique stage of social and biological development because it's a time also of laying foundation for good health. So we don't only focus on adolescent problems, but also from the positive side, we need to look at them as a good foundation for good health for the future. They experience rapid physical, cognitive, and social growth. And of course, this affects how they feel, think, and make decisions, but also interact with the world around them. But despite the societal view that they are actually quite healthy, they face significant challenges and problems, and sadly, they die of preventable illnesses, including injuries as well. So during adolescence, positive and negative patterns of behaviors develop, including diet, physical activities, substance use and abuse, but also sexual activities. And these behaviors could protect their health, but also could become a risk to people around them, and which is why we are concerned as health workers. And therefore, there's an urgent need for age-appropriate information on sexuality, and also opportunities to develop life skills, develop and promote adolescent-friendly and equitable health services, and as well as safe spaces, within the environment. And like I've been hearing in the past 2 days, have meaningful participation, especially in the design and implementation of the programs and interventions for them. So this participation should be meaningful, they should be part of it, but also we need to expand opportunities for adolescent-specific needs and rights. So communicable diseases, specifically HIV and STIs, we estimate that about 1.7 million adolescents, 10 to 19, are actually living with HIV, and 90% of this number is within our region. And also, TB is still a big problem, especially for the under 15 adolescents. So early pregnancy and childbirth is still an issue, and nearly 12 million people, girls, 15 to 19, give birth in low-income countries or regions, and half of them, of these pregnancies, are unintended, which calls for a need to provide reproductive health services. There's also high prevalence of unsafe abortions, and yesterday we had some discussion around that. And also there's a lot of records which are inaccurate, and especially for countries whose abortions are not provided. I had a discussion with somebody in this conference from Mozambique, a doctor, who was telling us on how safe abortions are provided in Mozambique. We also have other, not only reproductive health problems, but we also have unintentional injuries, road traffic problems, and drowning, but also interpersonal violence, which also brings adolescents at risk. One other challenges that faces these adolescents is alcohol use and drug abuse as well. And globally, 1/4 of adolescents 15 to 19 are actually current drinkers, but also there's high use of cannabis, which is a risk factor for reproductive health and HIV. I will skip the mental health bit because we had a good discussion yesterday. And also nutrition. Many boys and girls in low-income countries enter adolescence when they're actually not well nourished, and that has also an impact on reproductive health. So the discrete need for adolescents that spark demand for health services. So we need to stimulate demand for high-quality services for these young people, adolescent young people. And adolescent services should ensure a number of dimensions that should be provided within the services that we offer. So we need to have, they should be accessible as one of the dimensions. They should be appropriate and acceptable to these young people. And also, we need to ensure that they are in the right place at the right time. And usually, adolescents are not necessarily earning, so the price should be affordable, and also they should be provided in a style that is acceptable to these young people. So equitable and non-discriminative services should be offered. We should not have discrimination according to gender, ethnicity, religion, disability, and social status. We should ensure that our services reach most vulnerable people, adolescents, because usually they lack the services, and the services should be comprehensive as much as possible. There's a challenge of unmotivated health workers, either because of the long lines that we had yesterday of patients, but also how much are they working for. That is the pay that they have. So our states and governments need to pay attention to this if we are to offer good services for the young people. So community members should understand the benefits of adolescents, the benefits of adolescents, and the gains that we have when we have a healthy population of adolescents. And the healthcare providers should, as much as possible, be judgmental. Once there's no judgmental attitude, then we spark demand for these adolescents. So the point of care of service delivery should ensure that consultations are not too long to bore them. Usually the waiting time is a send-off to these adolescents when they seek services. And also referrals should be to the places that are acceptable to these adolescents. Sorry, I skipped a bit. So this is just a framework to show how we need to look at an adolescence within this concentric band. So the effective response to support adolescent health should develop the required range of actors as well as sectors at different stages, at individual level, interpersonal level, community level, and organizational level, within the environmental space, and numerous factors protect or undermine adolescent health, having their impact at the different levels. So I will just highlight two institutions that we think are good cases for which to learn from. So in Uganda, we have the Infectious Diseases Institute, and I think somebody from DRC was telling me yesterday, the doctor from DRC, he's been part of the beneficiary of this institution. It has got an adolescent clinic, which also prepares adolescents transitioning from being adolescents to young adults. It's a large clinic with over 950 young adults, and it provides free and comprehensive services that address complex problems. And the services provided are both clinical care, clinical and lab. Then also they provide psychosocial support. They provide sexual and reproductive health services, including family planning, as well as educational support, but basically focusing on the skills building as well as entrepreneurship for these adolescents. And these adolescents are prepared to move from their stage of being young to the stage of being older, and in a gradual way, are also in an individualized fashion. So it addresses the unmet needs, improves the health outcomes, and conducts research, and it's also a platform for, as a model within most of the country, and we get training into this, this unit. We have a number of multidisciplinary teams, the doctors, the nurses, counselors, but also, more importantly, the adolescents themselves participate in providing care, including psychosocial support to their peers. The other is the Naguru Teenage Information and Health Center, which was established actually 30 years back at the height of HIV in Uganda when it was very high. Just for your information, we've moved from prevalence of 30% to actually I think 5%, and among the adolescents it's as low as 1 for the boys, 1.1, and then 3.3 for the girls within that age group. So it's been a long story. And they also target the 10 to 14, and they focus on providing safe, non-judgmental spaces for adolescents, as well as information which would be lacking. And maybe unique also here is that they provide also a lot of advocacy and leadership, as well as training, that they also mentor other institutions within the country to provide youth clinics around the country in the districts which they provide services. So in conclusion, I would like to say that adolescent health services really should emphasize creating a confidential, accessible, adolescent-focused environment where adolescents feel comfortable to seek care and give services available through an integrated way. And also the key elements should ensure that there is participation in the decision-making spaces and maintain the strict confidentiality, because it's one of the put-offs. When adolescents does not feel that the confidential part is taken care of, then you know that there will be a challenge because the adolescents will just not come, which will comprise the demand for the services which you may have invested in them. Other areas of research from scanning the environment, I feel that there's a lot of substance use that is seeping into especially the secondary schools, the boarding schools, and that's an area which maybe I would interest us to take a close look at, but also in terms of use of drugs, smokeless thing is also coming into the young people, and also they want to feel cool, so there's a lot of smoking as well. So the tobacco industry is becoming much more clever than we feel. So thank you very much for listening to me, and I invite you to our university, the School of Public Health. We offer a big menu for postgraduate training, and the list is here. Thank you so much.